Um, so you know the scheme for this Bible now. It's not supposed to be an issue now because today I will see someone saying, I thought they said score is not there. I thought they said this one is not there. You should know what the scope is: upper limb, lower limb, chest, and bones of the thorax. What is the bones of the thorax? Sternum and ribs. So you will not say that they did not tell you when you pick blunt injury to a sternum and you are looking at them, you don't know what to do. Or you go and say PHS, you come out and say they did not tell you that it's there. Bones of the thorax is part of the skin, and then um, pelvis, right? The pelvis is not actually meant to be there, but I've seen people that picked pelvis. So since you um, learn how to position femur, what is there to just move up a bit to pelvis? So that's why I like adding pelvis. So this is five: upper limb, lower limb, pelvis, chest, and what bones of the thorax, which is what sternum and the ribs. Now, your Bible is on Wednesday, right? Okay. So first of all, I will start with the first one is cracking sound of the knee, or cracking sound in the knee, right? Um, so it usually comes like cracking sound in the knee, very loose body. So like you said before, you mentioned something. You said for the people that have read Clark, now why I start. A lot of people, when reading Clark, they ignore the first page that is found on like every part of the body. Like if you go to upper limb section, you will see a table. There is a table there, a very big table. Before you now enter hand, which is the first thing in upper limb. But a lot of people ignore that table. Like I'm sure in this place, if there are 100 people here, maybe only 10 people have looked at that table. And if I did not mention it today, might not even look at it till you graduate. In that table, there's some pathologies there and what you should do for those pathologies. Right? Now, if you go back home, just open to that first page, you'll see that table, you'll see things there that you're supposed to do. So it can also help you because they also pick your Viva questions from that place. Now, cracking sound in the knee. In Clark, it is no on the normal, it's supposed to be it's intercondylar notch actually, right? But then you're not supposed to go straight to saying intercondylar notch. So if you say intercondylar notch, you'll get C, but it's correct, right? So you're supposed to say the AP lateral and then intercondylar notch. So that for some lecturers, if you say just AP and lateral, you get A. It has happened before. It happened in my third year. It happened in my fourth year. It has happened, and people keep on making the same mistake. Like someone that I still told still went and go and pick only, and still went and said only intercontinental notch. And the person got B. I think they even try for the person. So for cracking sound in the knee, you do AP, lateral, and um, cracking sound in the knee, you do AP, lateral, and what? Intercontinental notch. So you can do anyone. You have to learn the two. Most people learn racing starts because they feel it's easy. The centering point is easy. Center that they were, publica fossa, right? Right? Okay. But learn the two of them. The other one has an angulation, but still, the centering point is not very hard. You have to learn the two of them. Um, DFU. What is DFU? Diabetic foot ulcer. So if you pick DFU, most times, for the lecturers that don't ask pathology, equipment, and acronyms, they will ask you their extra questions from your this thing, from your technique. So like they ask you the extra questions from your technique. So something like DFU now, if you pick DFU, you okay, so for someone like Dr. Sobena, if he asks you what is the um maybe not necessarily radiation protection, he might ask you patient care now for DFU, patient care. You are supposed to reason with your head. Someone that has diabetic foot ulcer, that means there's what is an ulcer? And thing they can ask you, okay, what is an ulcer? Because you pick DFU now, what is an ulcer? Say, okay, an ulcer is an open sore. Right? It can occur internally and externally because there's gastric ulcer now that occurs inside the body. And then now for someone that has DFU, obviously you have to wrap the cassette up now because it's DFU, it's an open sore. Yeah, it's not supposed to the person is not supposed to be in contact with the cassette, right? This is like common knowledge. These are things you can see. Like, okay, this person is actually knows what he or she is doing. But whenever you're saying anything, don't forget to add explanations. So even if you pick atelectasis, know what that is now. Middle lobe collapse or collapse of the lungs, actually. Middle lobe collapse. Um, you cannot just go and start saying 150 centimeters. You say because my area of interest is the words lungs, I will use 150 centimeters. Even when okay, even if it's a female that you enter with and it's your partner and you're positioning the person for chest, you cannot just say 35 by 35. Right? It be like because of the my patient, I will use so and so. Okay, because of the body habitus. After critically looking at my patient's body habitus, I will use an exposure factor of so that it will look like if you actually thought about it and you're not just pouring values you can't, right? Okay. Um so for DFU, you do what? Dozy plantar and dozy plantar oblique. Um the next is swelling of the left forearm. So swelling of the left forearm, you do what? AP and lateral. They might ask you a question like, why don't you do PA? Or why is PA not done? It's in your clerk, right? Because the the two bones will like superimpose. Then the next is swelling of the humerus. Swelling of the humerus is what? AP and lateral of the humerus. You know where your humerus is? A lot of people, when they are under tension, they will go and start positioning femur instead of humerus, or instead of femur, you start positioning humerus. I've heard it countless, like a lot of times. So, or maybe instead of positioning tibia and fibula, you position radius and ulnar forward. Please let's be quiet, please. The next one is Koch disease. What is Koch disease? Tuberculosis of the what? So what is another name for Koch disease? What? Okay. So Koch disease is pulmonary tuberculosis. So they might ask you another name for it, and you'll be saying tuberculosis of the lungs. They'll be looking at it. It's another name is pulmonary tuberculosis. So for pulmonary tuberculosis, you do PHS, and another additional thing you can do is the apical projection. The apical projection is two types. There's the PA apical and the AP apical. So if you will say PA chest and then apical projection, so that at least you will be able to like score points. You might just say PA chest and then get away with it and get an A, right? But some people, some lecturers might ask you okay, what is the additional V? You will now say what? Apical. They might even tell you to what? Position it. And it's not hard. Right? So, number seven. Yeah. Congenital abnormality. Query polydactyl. You know the query symbol now. So if you see question mark and I say question mark polydactyl, you have started saying question mark is for query. So you query polydactyl. For polydactyl, you do both hands. So you can actually do the two of them. That is DP, both hands, and what? Ball catchers. So you can just say there are two. Then they might tell you, "Oh, yeah, do one." You understand? It's better to be on the safe side by saying what? The two of them, right? Than saying only one. Like you said, if a pathology is supposed to have three projections, say the three of them instead of saying one and then leaving yourself open. Then the next one, blunt injury to the chest, query sternal injury. So if you hear this now, you'll be like, okay, it's PHS, so blunt injury to the chest. That's where everything has started going wrong. Like I said, sternum is part of the word skin. Who can tell me the views of the sternum? Anterior oblique and what? Lateral. Where do you center for lateral? 2.5 centimeter below the what? Sternal angle. Then anterior oblique is centered what? 7.5 centimeter what? Lateral to the what? To the what? On the raised what? On the side nearest to the what? 2. Um, so you just tell them that we do anterior oblique and lateral. Then they will tell you to, if there's no time, they'll tell you to do one. If there's time, you do what? Two of them. Right? Then number 10. Okay. Next one is osteoarthritis of the knee. OA of the knee. For osteoarthritis, you have to do for osteoarthritis of any joint. Okay, guys, let's say let me okay, let me not say it's any joint actually, sha, but for osteoarthritis of the knee, you have to do what? Both knee. So if you tell them I'll be doing AP both knee, they'll tell you, okay, why? Because it must follow, that question must follow, right? So you'll be like to assess the what? Joint space. Because you want to assess the joint space. So even though the osteoarthritis, it might be osteoarthritis of the right knee. You pick it like because you cannot just pick osteoarthritis of the knee. You feel like osteoarthritis, query osteoarthritis of the what? Right knee. Then because of that thing, you might just do AP of the um right knee. That is wrong. So you do what? AP both knee in what? Weight bearing. In order to what? Assess the joint space. Then query middle long collapse. Middle long collapse. Yes. No, no, you do it at the same time. It's weight bearing. No, when they say, okay, another question they might ask you is, what is weight bearing? Like, if you say, I will do AP both knee, like weight bearing, they'll be like, okay, what is weight bearing? So, what is weight bearing? So, okay, so weight bearing means that the in that instance, the weight of the body is acting on the joints. That is like weight bearing. So when you do lateral erect, that is what weight bearing. When you are trying to check for what pes planus with lateral erect, that is also what weight bearing. When the weight of the body is on the joint. So you do it AP both knee, you do it at the same time now. You center, like you said, can say at the midline or the mid sagittal plane, they are both the same. At the level of the what 2.5 cm below the apex of the what patella. So like both knee at the same time, weight bearing. Don't lie your patient down. Like if you pick osteoarthritis of the knee, you pick genu valvum or genu varus. Don't lie your patient down. Once you do that, your exam has ended. And again, if you are going to do any view, any projection that will make you put the patient on the couch, you have to tell the patient to pull off their shoe. Take note. If you don't tell the patient to pull off their shoe, you will penalize for it. Like they might not tell you. Let's say I'm coming. Let's say I'm coming. Let's say it's something like femur. Right? Be like how does the shoe correlate to the femur? At least, even if there's no time, tell the patient that okay, please don't help the person to off the shoe. Please, can you pull off your shoe? Then they will not tell you, don't worry, there's no time. Let him lie down. But it's not you will not just tell the patient go and lie down. No, no, no. You must make moves to try to pull off the shoe. You don't pull off the shoe, then out of the 20 marks you're supposed to get from positioning, you might be getting like maybe 10 on you might like maybe if it's another person, maybe you might even feel yourself. So pull off the shoe, take note. Then okay, swelling of the right thigh. Swelling of the right thigh is what? AP and lateral femur. That is right thigh. The thigh is femur. This dyspnea, query pneumonia consolidation. So if it's maybe another person, or maybe Dr. Aboyi, he might ask you, okay, what is dyspnea? Because you cannot be saying, I will do so and so. You don't know, and you don't know what dyspnea is. So what is dyspnea? Be like, dyspnea is what? What is dyspnea? So what? Okay, difficulty in breathing. I'm like, okay, what is pneumonia? What is pneumonia? What is pneumonia? He said, I'm not hearing anything. No. These are the kind of questions when they say they ask pathology, what do you think they're asking? Is what is this, what is that, right? They asked my friend what is rhinitis. What is rhinitis? Do you know what rhinitis is? Have you heard of rhinitis before? Okay. So it's actually inflammation of the mucous membrane of the nose. Um, like he said, they asked me once what is sciatica. Right? So if you have not even heard what that is, so that's why that fiber material, like I was saying before, everyone that asks me how can they prepare for Viva, it's easy to prepare for Viva. Take the Viva material, the Viva that radio Viva material, the one that has pathology. Read those pathology. All these things is not hard. Like instead of wasting that time reading score, and I don't know where you got the information that abdomen and other things is there, and wasting your time there. Carry the Viva material, read those pathologies there, start learning it. The people that do well in Viva and that can face everybody are the people that actually read that Bible material. There are people that actually, on the Bible day, if you told them, okay, what is BO, what is GOPD, what is this, they will tell you what is CKD, this is how Dr. Abu will be asking, what is CKD, what is CLD, what is GOPD, you'll be looking there, you don't know what they are saying. And so, you, so, so try to learn as much, like as many pathologies as you can learn. Try to learn as many acronyms as you can learn. You might not be able to learn everything. Even though I know my friends that actually they know everything in the book, in that book. Like there's no way, there's no one you're asking them that they don't answer. So, but you might not be able to learn anything, especially now. There are people I told, okay, in first aid, told someone at the beginning of the semester, take this Java material and start learning everything there. Person did as I told him, and actually, the person got A in Viva. What they asked the person was um, neck of the humerus. Now, query fracture the neck of the humerus. This, what will you do? Say what? AP and lateral. So it shows that you have not read neck of the humerus in class before. It's actually so now imagine for him to be the first person in his group to pick neck of the humerus and still be able to get an A. You have to know how prepared the person was for the exam. It's not about I don't know. Like the person was actually very prepared because okay, the extra question. What was the extra question they asked the person? They asked the person to mention the muscles of the thigh. Then asked the person that another name for Sartorius. Like it was actually Dr. Sobe that asked the question. So like that's why I said that you can never be very prepared. Wait, let me talk now. Let me talk, please. Um, you can never be prepared for the extra questions. You can never be prepared for it. Like you don't know everything. You don't know everything, right? But you can try your best. Um, there's something my colleague did not mention. So the extra questions can come when you enter, and it can come when you are done. So someone like probably maybe Dr. Oloma will ask you the questions after you are done. But Dr. Aboyi, when you are entering, like immediately he looks at you, we are seeing your lab coat, you say, okay, where did you borrow this lab coat from? And you say, okay, I borrowed. So it's my own, it's my own. You say, okay. You ask, okay, what is nephrolithiasis? What is pneumonia? What is? Then by the time you have filled everything there, you will now pick something and you'll be very tense. Maybe you might speak Thai and start doing pelvis or something. So the main thing is that what I'm trying to say is that's why you have to try to read why, which is pathology, acronym, equipment. You don't know everything, right? But your residual knowledge should actually come in hand in case maybe when they start asking you all these things. Okay, now who have heard of COPD? What is COPD? So now what is now GOPD? So now when I entered with my partner, they asked her what is GOPD. I was like, GOPD. I've never heard GOPD before. But she said general outpatient department. So now imagine hearing COPD is um then you now hear GOPD, you say gastric obstructive. That's it now. So let's move on. Next one is pain to the elbow joint. It's PHS, PA erect. Then pain to the elbow joint is AP and what? Lateral elbow. Query fracture of the rib. So what is the views for ribs? You know why this rib is an issue? Like if you pick this rib, omo, if you don't if you don't take your time, omo, you will. I don't even know. Let me not say it. But the main thing is that there's a way this rib is very confusing. Like if you pick this rib, I don't know. But the main thing is that what I will say if I pick rib, because if you read your class, you see upper rib, lower ribs, AP, and different rubbish. But what I would say is I will do oblique. Now, when Dr. Amoy was talking to us, he told us that for ribs, if it is the anterior rib, because obviously the rib, there's the anterior and the what? Posterior. So if it's the anterior rib that is fractured, you do what? Anterior oblique. If it's the what? Posterior rib that is fractured, you do what? Posterior oblique. So it can come in different ways. They can say query fracture to the rib, flank pain, query rib fracture, flank pain, just flank pain. Where's your flank? Here now. Here's your flank. So that is rib. But now, so after he told us this thing, someone still picked rib. Then started saying I will do whatever with the lower rib. I said, "Ah, what is okay, no, what is in Clark self is posterior oblique, I mean. In Clark, what is in Clark for ribs? Posterior oblique. So now he now asked the person, so if it's in the anterior side of the anterior rib, what will happen? The person did not know it. So like when the person came out, was not telling me, I was not telling her, was he not in class the day that he said this thing? So what I'm saying is that for this read, the only thing that will save you is your explanation. Because there's nothing you will do there that will save you because of how complex the read is, except you explain. So you will tell the person that for so and so so and so, for the posterior, if the fracture is at the posterior rib, I will do what? Posterior oblique. So it can be left or right posterior oblique. Hmm. Then if it's at the anterior rib, I will do what? Anterior oblique. Then you leave all those other AP and don't be tempted to say chest. Oh. If you say chest, you will fail because they want to hear the specific view for that part of the body. If you pick sternum, you say chest, you will fail. So now, the next one is what? HHD. What is HHD? So you use an FFD of what? An FFD of what? 180 PHS. Then another very complex one is stiffness of the elbow. Stiffness of the elbow. What will you do for stiffness of the elbow? What will you do? I want to hear something. Said HHD. HHD. Hypertensive heart disease is for you will use 180 centimeter as your what? FFD. You do PHS for it. So I was saying something, stiffness of the elbow. Stiffness of the elbow. You do, she said yes. You do lateral elbow and what? AP partial flexion. Because what is stiffness? The joint cannot be extended. There's a definition for stiffness. Oh, I've actually forgotten it now. But there's an angle. So it just the joint is stiff, right? So now you can say I will do what? Lateral and AP partial flexion with the what? Arm in what? Contact. If you go to your class, you will see AP arm in contact. So for stiffness of the elbow, do lateral and what? AP and partial flexion. So it's AP partial flexion, arm in contact. Anything that make you put the hand like this, you will feel. Like that is just it's not there's no it's all or none. There's no two ways. Once you put the elbow in AP, full AP, then that's it. That, the what? No, use arm in contact like this. Because the hand cannot what extend now. It's cannot extend fully because it's stiff. People are making noise and people are missing out on this thing. And someone will still make this mistake, but there's no problem. Um, Numbness of the hand, query carpal tunnel syndrome. You do what? Exhale. Your centering point. The centering point is to give people issues. So you have to learn that centering point very well. Learn it very well because you might do the stuff finish. Another thing is that you will come now. It's supposed to be like this. You face back, right? Then you learn the centering point very well. It can be okay. Now for for elder, if you pick carpal tunnel syndrome, before saying exhale, tell him about PA wrist, the wrist projection PA. So you tell him that I will do a PA and what exhale because if you have not read that, if any of you here have read that section, that beginning of upper limb, you will see it there. After exhale, you can also do what PA wrist. Now, because for someone like Elder now, if you pick um, cracking sound in me and you tell him intercondylar notch, you are wrong. You are automatically wrong. That one you might. you might not even survive it. At least maybe for another place, if you do just intercontinental notch, you might get sick. But with him, you might even feel yourself. So the main thing is you tell him AP and lateral. Okay, there was someone now. He picked this thing, intercontinental notch. Parkinson in the knee. He told him intercontinental notch. Said it's wrong. Then the person now picked again, now picked carpal tunnel syndrome. He did the XR, he told him it's wrong. Like this, your Bible just going everywhere, right? So before you know, the result come and you get it. Like how did it happen? Yeah, so then another thing is the people what carpal tunnel is HCL now. No, I said are you people really I said for elder you can add what? I did not say it's wrong. XDR is not what? Wrong. Right? But since the Bible is a what? Subjective exam. Okay now, someone like elder now, if you want to do robotic, let me use some why did you turn your face? Come. So if you want to do Lodotic now for Elder, come now, let me show you. Elder might buy you. I should use my colleague here. I want to say. Don't worry, don't worry. Okay, come. So for Elder now, the Lodotic, you sit down, right? Then you do the class. But when he was telling us about Lodotic, that is after someone has done that particular one in Clark. He now came. He said